Right, let's have a look at this case. So I think there's a poll on this one. So if you feel like it, you can definitely take part. So let's have a look. You know what? I spelled, it's my dyslexia coming in, isn't it? So I spelled rib fractures wrong. Apologies in advance. So what can cause pleural plaques is my question because there are multiple pleural plaques in this. Let's have a look. So this is a non-contrast CT scan, and I guess they're trying to look for any long-term changes. So what we'll do, we'll have a look at the X-ray first. And I remember when I first started radiology, or even when I was a junior doctor on the ward, this used to scare me, like, oh my God, they've got cancer. But that's not generally the case. If it looks like this, and they actually say they look like holly leaves, I think that's the way they describe it, like these kind of zigzaggy leaves all over the chest. And sometimes you see them kind of curve round the side, and that's because they're pleurally based. So things that curve round are going to be pleurally based lesions. And so these are multiple what looks like calcified densities, and you can see, they're calcified because they kind of almost look like the ribs in terms of its density. So these are calcifications, and some of them do feel like they're kind of going round the chest, round the chest, round the chest over here. And then the lungs actually look pretty clear, but I would be a bit concerned that there could be maybe some consolidative changes there depending on the clinical history. Now, my scan hasn't quite uploaded fully, so let me just reset all. Let's go to long windows. Let's have a look. So, as you scroll through, again, they've had a fair bit of breathing artifact. What have they said? Yeah, yeah, of course. Yeah. I know. I didn't put asbestosis as a choice just to but, oh yeah, so the reason why I didn't put asbestosis as a choice because I thought it's fairly easy. That would be the primary cause for this, undoubtedly. There are multiple reasons for pleural calcifications. It can be infection. It could be like a pleurodesis because someone's trying to reduce the chance of having pleural effusions. Rib fractures can cause it because what ends up happening is if you have a rib fracture and the lungs are sort of breathing away and they keep rubbing against each other, then that can end up having like a what looks like a pleural plaque. So I just tried to throw something that maybe some people wouldn't expect, but you're right. In this particular situation, it's going to be most likely to be secondary to asbestosis exposure. You would worry about mesothelioma in a patient with asbestos exposure. The reason why it's not mesothelioma in this particular case, it's not a circumferential pleural thickening. So this is the pleura here, and you'd be looking at pleural thickening, circumferential pleural thickening, particularly of the mediastinum in a mesothelioma, along with the multiple pleural plaques. You do have multiple calcifications everywhere. They have breathed a lot, so it can be a bit difficult to really appreciate what's happened, but you can get a bit of fibrosis as a result of the previous asbestos exposure. And then we were concerned as there could be some consolidative changes located within the right lower lobe. And I think there could be. Can you see there? It just starts to look a little bit more hazy, a little bit more well-defined around that pleural plaque. There could be. Well, the reason I put it up was just to show you what pleural plaques, and like I said, there are varying ability that come to this these talks, and yeah, fair enough, maybe simple. Let's go to the very top of this one as well. Make sure we don't miss a renal cancer because that almost happened. And yeah, these look like very well-defined renal cysts. The upper abdomen looks completely normal. So yeah, we could walk away saying this is not unlikely to be mesothelioma. There's a lot of breathing artifact and multiple pleural plaques, potentially some consolidation located within the right lung base. No other significant findings. Cool. So we are coming up to the last one, and oh yeah, so let's share results. So actually, lymphadenopathy. So lymphadenopathy wouldn't really cause pleural plaques. You get calcifications of the lymph nodes. Lymph nodes would normally be the mediastinum for the hilar regions, right? They normally follow the vessels and stuff, so you probably wouldn't get that. Consolidation, I guess so, if you get a paranomic the pleural effusion secondary to consolidation, but generally speaking, it wouldn't. Rib fractures, like I said, which I spelt wrong, normally it's that rubbing sensation that can cause rib fractures.